Now we're moving to next unit. We're talking about diarrhea. 谢谢. Same pronunciation with Chinese. Thank you. But truly, different Chinese correction. Yeah. Diarrhea, 谢谢 in Chinese. So that's the stone's problem. So what is diarrhea? What is diarrhea? So basically, it's more liquid in the stool. So that's sometimes we talk about abdominal losing stool. And most people have frequently. But generally speaking, when we're talking about diarrhea, it's kind of abnormal losing stool. So basically, provides the medicine. They may separate the diarrhea to the infection kind of diarrhea and the no-infection kind of diarrhea. Infection kind of diarrhea, including virus infection, bacterial infection, fungal infections, and sometimes parasites. And no-infection kind of diarrhea basically is caused by some imported food or maybe just allergy and maybe some other forms. So that's generally diarrhea. So for TCM, for TCI, what the etiology and pathology aspected. So what caused the children diarrhea? So many reasons, some external pathogen evading, and some imported kind of food or drink, and maybe spleen stomach. We say that's middle jaw deficiency. Pretty similar like we talking about last illness. But the last illness mainly is not property food or maybe spleen stomach deficiency. But truly diarrhea may be relationship with external pathogens. So mainly illness affected part, middle jaw, spleen, stomach. So if it damaged by external pathogens, so that's losing functions. Still TNT functions will be losing. And the fluid will be accumulations in the intestine internally. So that's some damage. And certainly some damage inside and infected digestion functions, infected TNT functions, then cause the food stagnation. And blocking normally ascending, descending functions. So that's then caused some damage, accumulation, and even phlegm blocking there. So that's the situation we talked about. Couldn't separate pore and tuberate. So that's then all the mixed together go to large intestine with some stagnation kind of food, then pass into the stool, then cause diarrhea. So that's by TCM affected why the diarrhea happens. But truly, when we talking about diarrhea, we will have different patterns. So first pattern we talking about diarrhea due to damp heat pattern. So damp heat mainly, finally, they will go to large intestine. So that causes the patient urgent and frequently bowel movement. And also with lot of water inside because damp. And a pretty bad smell inside because damp heat. And maybe have some mucus in there. And patient's abdominal pain time to time, sometimes painful, and then let it be relieved, and then coming back painful again. And for the children, they will cry. And also post-op fever. So these kind of condition, thirsty, thirsty. They try to drink some water, but they don't want to drink too much because damp is inside and losing appetite. Yeah, don't want to eat it. Sometimes nausea, vomiting. So that's stomach achieve worse. And some heat inside cause urination, yellow color and scanty. So that's basic pattern, damp heat accumulation. Tongue is red, yeah, with yellow coating that's coming from heat. Greasy tongue coating coming from dampness. Sleepy pulse coming from dampness. Rapid pulse coming from the heat. And if we look in the finger veins, super color. So damp heat, still heat, still heat. So still purple color in there. So that's for this condition. So the treatment, certainly we need clear heat, remove dampness, and stop diarrhea. Stop diarrhea. So the points. Stomach 25 fundamental points of large intestine. So generally we can use for treat for diarrhea. Also we can use it treat for constipation. Generally speaking, we see the problems, whatever diarrhea or constipation, is excessive condition or deficiency condition. Excessive condition, we will reduce it. We are not including constipation or diarrhea to decide it with technique. We need to follow the pattern. It's excessive pattern, reduce it. Deficiency pattern, tonify. So even the same points, we can working for different kind of conditions, diarrhea and constipation, excessive or deficiency. And LF4, 原sounds points of the large intestine, truly working for large intestine disorder. And lung 11, lung 11. So that's 精苗 points, 精苗 points of the lung. So we can clear some heat from lung channel for the large intestine. Certainly, you still can go to LI1, 精苗 points, large intestine channel, still working. LI11, clear internal heat, stomach 36, tonified points. So for the children's problem, most pattern is kind of excessive with deficiency or deficiency with excessive. So mainly for children's problem, we need to pick up some tonified points. We try not only pick up points for reducing, not only tonified. So that's in the book, they say all the points with reducing technique. But truly for myself, I still like to keep the stomach 36, at least for 25. And we can keep the needles about 5 minutes, or maybe just some manipulation and just withdraw the needles. It's depending. Like we talking about, if the kids under 2 or 3 years old, it's pretty hard to maintain the needles. They always try to move it. So you are pretty hard to retain the needle there. So you can just put one needle in and the manipulation in there, and then restart. Then go to another point. Manipulation, restart. So if your patient like too small, like the patient 5, 6, or even 7, 8 years old. So basically, if you're talking to them, they can understand it. So in that kind of case, you could keep the needle there about 5 minutes. So totally depending. And if it's acute condition, we try to treat like 1 to 2 times daily. So 4 days of 1 session. So truly this pattern, damp heat pattern, usually caused by external pathogens. Usually it's acute condition. So acute condition, we try to treat sections more closely to review it. Then we talking about pattern. Diarrhea due to wind cold. So that happens. Yeah, that happens. Patient got EPI wind cold attack, and then diarrhea. That's not that easily happens in the adult, but truly it happens in the case. So that's for incident some problems. So EPI wind cold attacking, we have general EPI cold attacking symptoms here. Kind of aversion to cold, fever same time, that's EPI. And then they have nose discharging and maybe body ache, headache, and maybe cough. 糖又来 not changing, even cold, not changing too much. But the pulse is floating and tight. If we're looking for the finger ring, it's kind of red color in it, but more go to pale side. It's not too red, but that's still cold condition. So treatment principle: dispersing wind and remove cold. And cold sometimes cause some damage. That's why the children have diarrhea. Diarrhea is still kind of damage in large intestine. And also this kind of damage caused by middle gel disorder. Spring TNT not working. So that still need a regular middle gel. Yeah, this kind of case, not that too stronger smell. Generally cold part. Generally cold part will not that stronger bad smell. Heat part usually can cause, especially damp heat part, usually can cause like bad smell. But with the cold part for sure. We didn't put with the heat part here. With the heat not that easily cause diarrhea. Generally, it's with the cold cause diarrhea. But truly, large intestine heat, like first one we talked about damp heat accumulation, that causes the bad smell. So expel wind and remove cold and relieve damage. And we still need a regular middle gel. So acupoints, stomach 25, that's the same. Stomach 37, lower Hershey points of small intestine. Then 6, key points. So that's basically kind of avoid with more regular middle gel. So truly, if patients still have external passenger evading symptoms there, like aversion to cold and fever same time, if patients still have that kind of symptoms, we still can use some points relieve external. But here, because the patient's mainly symptoms is diarrhea, so that all the points here will not specially go to relieve external. But if we truly need to relieve external, we still can use like a lung 7, LS4, or maybe TB20, some wind points. But here there's mainly regular middle gel and then more damage stop diarrhea. So still keep the needles about 5 minutes, or maybe just manipulation without needles, and still treat 1 to 2 times a day, and 4 days like one treatment cycle. Maxa. So cold condition, we can think about maxa. Heat condition, generally say we are not thinking about maxa. So maxa A, that's pretty good point for maxa. umbilicus will not needle them, but is good point for maxa. 人跳 still middle jaw regulating. And stomach 36. Spleen stomach tonified. So basically that's points here with maxa is tonified. So we say body 整体 strong, passenger or passenger evils will not be evaded. Patient getting sick, it must be have some body 整体 deficiency. So that's generally say we do indirect maxa for the case, not directly maxa for the case. So that's the pattern we say in the code pattern. Then we go to another pattern, food damage. Like we just talked about illness, food retention or food stagnation. Then damage middle jaw function, spleen, stomach. So generally speaking, these symptoms, certainly diarrhea, the symptoms will including losing stool. But when you're looking inside the stool, they always have some undigested food inside, including the milk. And truly this one, particularly by smell, like a rotten egg. So that's certified smell coming from the food stagnation. And also patient will have stomach and abdominal distension and painful. After bowel movement, the painful situation kind of relief, so they like or desert to go to bowel movement and relieve something. They feel better, so relieve after diarrhea, but they go to bowel movement, they still suffer diarrhea. And the painful situation worse by pressure. So that means it caused by excessive condition. Pressure relieved by the pressure is decreased. Pressure worse by the painful worse by the pressure is excessive. So that's truly this one. Food stagnation belong to excessive kind of condition. And the patient also possible nausea, vomiting, and some bad smell coming from nausea, vomiting, and certainly no appetite. Like we just talking about the food retention. No appetite. And the food retention make abdominal painful situation. People restless and couldn't feel sleep. The tongue is right tongue. So we say generally children a little bit more right tongue compared with adults. But think greasy tongue coating coming from food stagnation. House sleepy still coming from food stagnation. And rapid coming from heat. So blocking there and then changing to some heat. and looking the wind. Yeah, looking the wind is down. It's down. And slightly, yeah, slightly. This is kind of is not that clear, or maybe some curves in there. So that means internal disorder. So that food retention truly damage internal body functions. So treatment principle, we need to tonify the spleen function, then harmonize middle jaw stomach, and dispersing food and remove damage, or we can say transform food, remove damage, remove stagnation. So points, yeah, acupoints, we have a lot of points pretty similar. Stomach 25, still find more of the large tongue. And stomach 36, still Malay middle jaw tonified. Yeah, still Malay middle jaw tonified. And 人跳 regular middle jaw. And also we can use the points 四缝. Yeah, also use the points 四缝. Still remember on the hand, yeah, on the hand, still the 4 fingers. We have 4 points in each hand, so that we can use treat the condition, kind of food stagnation, and the LFO, still South points of lifetime. So most points we use reducing technique, but I like you keep this one for 25 or even technique. And you still can keep needle there for about 5 minutes, or maybe just withdraw the needle after manipulation. So treat twice a day if you can, if you can. And also remember, we talked about before, if children don't like needles, they can use acupuncture instead. And 4 days as one section. And then we can stop couple days and then continue. Then next pattern we talking about spleen qi deficiency cause diarrhea. So this pattern pretty common in the adults, but it also happens in the children because we talking about before. For infants, organ is weaker, including spleen, including the lung, including the kidney, and also including the heart. But the spleen and the lung, that's the mainly key relationship organ. So when spleen qi deficiency, truly they are cause the losing stool and diarrhea. But generally speaking, this kind of losing stool or diarrhea is chronic process or chronic problems. So that's generally safe. And don't have special kind of smell coming from the stool usually. And So basically, this kind of diarrhea is intermittently. Sometimes getting better, and sometimes it's getting worse. Kind of sensitive changing there, and affected by lot of things, including emotions, including external passengers invading. So that's generally say for diarrhea. And also we see other symptom signs for deficiency. So spleen qi deficiency, pale face, emaciation. So spleen losing its function and poor appetite, don't want to eat, poor nutrition, and like generally weaker, pale tongue and pale face, and the pulse is weaker pulse and slow. If we're looking for the vein, index finger vein for under 3 years old children, is still pale color. Still pale color. So that's the diarrhea due to spleen deficiency, mainly spleen qi deficiency. When we're talking about the treatment pencil, certainly we need to tonify the spleen function, tonify qi. And then when spleen qi is stronger, their TNT function will be working. Then the diarrhea will be stopped. So the points, we still keep stomach 36, then 12, common points of the stomach. So abdominal, air, have disorder. We always can go to them. And also loss of the stomach. So very powerful points. And 人跳 middle jaw regulating points. Bladder 20, back through of the spleen. 人 4 generally 25 points. Pretty stronger generally 25 points. Like the place or 元气 located place. I think we talked about before. If people practice qi gong, they say bring qi to 丹田. So means 丹田 is holding 元气 place. So that's generally we're talking about practice qi gong. So that means if we tonify there, we tonify qi. Pretty stronger tonify qi. So 丹田. And 人 6, especially qi tonify. So that's generally we use some points we can tonify. So still we can use even technique or maybe tonify technique because all the points here mainly for tonify. And we can keep the needle there about 5 minutes, or maybe we just stop. Treat once a day. Treat once a day. And the 5 days as one treatment section. So truly, we still talking about you still can use acupuncture instead of needles, or maybe you treat every other day or twice a week, and you can try to pick up a little bit more needle. And also can use massage. Also can use massage. Massage is more tonified compared with needle. So for Chinese medicine, we have a lot of ways to treat the patient. We have herbs. We have massage. We have needles. So generally speaking, for tonify, herbs effections is bigger or more effective than massage because truly take some nutrition coming from the herb. And the massage more effective than the needle. So that means deficiency kind of condition. Because combination use herbs, massage, and needle. For excessive condition, we still have some herbs for reducing, but truly with the first choice for the needle. So that's clinically we use. Maxa pretty similar points here. Then 8, then 12, some 26. And we use indirect maxa. So generally we are not use direct maxa for the case because they always move and their skin pretty easily be damaged. So that's usually we are not use direct maxa for case, just indirect maxa. We could use maxa sticker or maybe other indirect maxa. And treat once daily, 5 days as one treatment section. Let's go to another pattern. Diarrhea due to spleen yang and qin yang deficiency. So that truly belong to internal cold pattern. So symptoms and signs. Yes, symptoms and signs. Chronic diarrhea. So deficiency problems mainly is chronic problems. And losing stool with undigested food inside. So generally say these kind of stool don't have special smell in there. Just clear kind of stool. And sometimes maybe happens prolapse of the rectum. So that's the qi sunken kind of condition. Severe kind of 气 deficiency. 气 belongs to yang. So that sometimes happens. And cold body, cold limbs. We say yang deficiency will including qi deficiency. So that's generally say yang deficiency will including all the symptoms with qi deficiency plus cold side. That's generally we're talking about yang deficiency plus cold side coming from symptoms qi deficiency. Pale face and lastly, that's yang deficiency. Some shen is not truly holding there. And even the eyes slightly open when children didn't sleep because their qi and yang couldn't performing function there. And clear urination. So generally say qi deficiency symptoms with cold side. Still possible have poor appetite. Still possible have abdominal distension. Pale tongue, pale tongue and pale face. And weaker pulse. Yes, psoriasis still belong to weaker pulse. And the vein basically just a little bit red color there. Little bit red color there. Light color for the vein. That's the difference. And the treatment principle, truly we need warming and tonified. Yang deficiency coming from spleen and stomach and kidney. Yes, spleen and kidney. So we need warming and tonify spleen and kidney. And stop diarrhea. So the points, Bacro of the spleen, bladder 20. Bacro of the kidney, bladder 23. And the stomach 36 is pretty good or stronger 25 points. And also rainfall, 25 points. Spleen 9, especially dry dummy. And certainly also 25 spleen function. So mainly with 25 technique, you can remove the needle immediately after insert needle manipulation, or maybe retention the needles for about 5 minutes. So generally for children, we are not keep the needle so long time, and the children not able to keep the needles so long time. So we treat once a day and 5 days as one treatment section. And then we can stop couple days and repeatedly treat it. Maxa, Yang deficiency. The first choice, good treatment plan. It is Maxa. We can Maxa with Ren 8, umbilicus air, good 25 points, good Maxa points. Rental, regular middle jaw there, and stomach 36, generally 25 points. So basically, we use indirect marker with marker sticker. And when the skin feel hot, that should be good. But still, by the day, 5 days after one treatment session, you can keep putting some needles, like we talking about the points here. Then you can do the mark at the same time. So generally say it's about 3 to 5 minutes. The skin will feel warm. Then we're talking about quarantine. So diarrhea is the problem combination with external passenger with internal kind of weakness. So we need very pay attention for food hygiene, especially with spleen deficiency kind of patient. Their Qi deficiency, defining Qi deficiency, so pretty easily cause infection and inflammation. So put fasting food and hygienic food for children. And don't eat any food like it's got some infection in there already. That's pretty easily cause infection in the digestive system. Overtime food not eating. And also not overeating the amount of food. Like we just talking about food stagnation. If patient eating too much for the instance, they may couldn't handle, then they damage spleen function. I think we talked about before. For Chinese, we have a sentence, especially talking about how to take care of the children. We say if like the baby healthy, keep 30% of hungry and 30% of like cold, means not put too many clothes on the body. If we like 100% full and put too much clothes on the infant, their body is more young in there. They are pretty easily cause the heat condition and pretty easily getting sick. So that's we say not overeating, not overeating. That's the way, healthy way to feed the baby and take care of the baby. And certainly we need hand hygiene also. Washing hands before feeding the baby, before prepare for the food for the baby. So that's also we clear everything used for the baby. So that's first aspect, hydrogen. Yeah, hydrogen. Second aspect, yeah, second aspect. That's basically relationship with medication use. So generally speaking, if patient use antibiotics, especially for infants, for long term, and also like that antibiotics can against most bacteria that can cause trouble for infant diarrhea. Because inside our intestine, especially large intestine, we have lot of good bacteria in there. It can produce vitamins, especially vitamin B. And they also keep the balance with the fungi, so they can control like a fungi infection. So if use antibiotics so long term, and that bacteria like killed most, that's the antibiotics killed most bacteria. That's also killed bacteria in the intestine. So normal bacteria in the intestine, we're talking about the normal flora. They keep the balance there. Now we kill it, that's losing the balance. So that's another reason maybe cause diarrhea. And also people with antibiotics long term also cause other problems, fungi infections. So that's kind of preventing. And nurse care. Yeah, nurse care still big part. Control the food. Yeah, control the food. Reducing some amount. Reducing like the amount food spleen and the stomach need to handle. So then gradually, the infant will be recovered. The patient will be recovered. When the symptoms getting some better, improves, and gradually get increase some food, give more amount kind of food, and give more different kind of food. So from beginning reducing the amount and reducing the kind of food, then gradually adding for later. And also we talked about already. Try not eating greasy food. Try not eating raw food, uncooked food, and also so cold food. So it's not a good idea to give the children so many ice cream. That's too cold. Damage their spleen function. And certainly polluted food not give to children. Hard to digest food not give to children. And for the babies, babies need to keep the skin is dry and clear in there. And always frequently changing the diaper, like the cover for the baby's bottle. So after each of the bowel movement is washing there. So still keep it clear. Yeah. Keep that region very clear with the warm water. And can give some powder and make it dry. Yeah, make it dry. And always looking for the babies if they have something wrong. Yeah, early signs something wrong in there. We need more attention. Like we talked about before. For children's problems, it happens faster and changing faster and recover faster. So that's basically for infants problems. So we need to pretty be careful to watching any kind of changes or any problems happen. So that's for diarrhea.